here we are already with the November 2025 issue highlights. November already. The year has just flown by. And I must say, we've had some great articles this year, and November is no different. I'm Jim Del Rosso, the editor-in-chief of the Journal of Clinical and Aesthetic Dermatology, which we affectionately refer to as JCAD, and colloquially often referred to as the Green Journal, which we're very happy with that designation. So, the first article is Non-Melanoma Skin Cancer in South Florida, a change in relative incidence of basal and squamous cell carcinoma. It's an article from Aventura, Florida, and Mark Nestor is the senior author, along with the other authors, Robert Venaria and Aisham Chowdhury. And this is very interesting because I remember, back even in my Mohs surgery fellowship from 1990 to 1991, where I helped edit a chapter for Ron Whelan's skin surgery and cutaneous oncology textbook. We had always been taught that basal cell carcinoma is more common than squamous cell carcinoma, about 70% basal cell carcinoma to about 30% squamous cell carcinoma. Well, this article notes that there was some papers that were written back in 2012, some from South Florida, and just overall looking at the difference in the prevalence of basal cell and squamous cell carcinoma, the relative incidence rates, and it's reversed. And they looked at up there in their practice down in South Florida. Look, it was 856 non-melanoma skin cancer lesions based on looking at all the biopsies in their practice. Basal cell carcinoma, including superficial and other subtypes of basal cell carcinoma, and squamous cell carcinoma, including in situ and invasive squamous cell carcinoma. It's flip-flop. There are actually 70% squamous cell carcinoma versus 30% basal cell carcinoma. And this has been shown apparently in some other studies, and that was somewhat of a surprise to me. So the question is, why? Now, I can understand in South Florida, you have an older population, you have a lot of individuals that for many years are getting a lot of sun exposure all throughout the year and are living longer. So there's more of a chance that you're going to get a squamous cell carcinoma, a greater increase in squamous cell carcinoma. But I think that is an interesting flip. And I think it's really important because of the potential for squamous cell carcinoma to metastasize. So that's an article that I think is very interesting and one worth reading. Another article that was interesting in terms of the source. It's from the Division of Pharmacovigilance, the Office of Surveillance and Epidemiology at the FDA, the U.S. Food and Drug Administration Center for Drug Evaluation and Research in Silver Spring, Maryland. That's that big building that's responsible for the FDA approval of the medications we use and several other things that happen in medicine, not only in dermatology. And they put together a very interesting article, and it's something that I am actually interested in because some years back I was looking at an airplane magazine, and there was a product that was being promoted that people can just buy. You could have done it on the airplane if you had access on a computer and order directly from the manufacturer to actually remove molds and skin tags and that individuals would buy and apply on their own without professional supervision. And this has actually grown over time. So they were looking at skin injuries following layperson application of chemical peel products. And actually, at that time, I wrote a letter to the American Academy of Dermatology, American Osteopathic College of Dermatology, and also the American Society of Dermatologic Surgery, and said, hey, what can be done about this? And that was years ago. And it's mounted that there are several different companies that are selling skin peeling products directly to the lay public. And so this was looked at, and based on their review, right? The United States Food and Drug Administration. They looked at adverse event reporting system, the human food complaint system, the literature, and Amazon.com, which is very, very common in terms of and com computer product reviews and images, right? Looking for potential that there were skin injuries following self-application without professional supervision. They were able to identify 18 skin injuries that led to significant problems that were verified, at least based on this particular paper. And patients had particular problems with wounds, pain, swelling, other types of injury, including scars. And really, it's a call to action to put a stop to this even further and to try to get dermatologists to make sure that they educate their patients if they're asked about these particular products. Some of these products have concentrations of agents that are typically only used under the care of a healthcare professional, especially someone that has expertise in skin chemical peeling. So this was brought forward to dermatology through the JCAD, and it happens. It's still out there, and it's probably something that's very, very hard to totally regulate and control. But if we observe it, we should report it, and if our patients ask about it, we should let them know that that's a dangerous thing to do. It's not because we're interested in the financial aspects of the chemical peeling, not at all. We just don't want to see people get hurt. The next article is an analysis of Reddit reveals clascoterone questions among people with acne. And this is an article by Wang, Patel, Minaroff, and Jared Jagdeo. Jared Jagdeo is very involved in a lot of different areas of dermatology, and he is the senior author. So I think this is very interesting because it 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 broke my heart to think that patients are going online to different types of social media reviews to ask questions about medications, right? And they may want to, I understand that people want to may get feedback from other people, but these are the questions that really I think need to be professionally answered. And the ones that came up in relationship to clascoterone, because obviously they looked at a variety of different questions that were asked overall on Reddit. Right. They look specifically at skincare subreddits such as small r / skincare addiction, small r / skincare _addiction, small r / skincare addicts, and small r / acne. So that's a different way of referencing than we typically do at the end of a journal article. And this is where they got the information from to look at this. There were 301 questions related to clascoterone, and interestingly, um, about 26% of them were typically in relationship to using topical clascoterone, which is Winlevi, which is a FDA-approved topical agent. It's the only androgen receptor inhibitor that we have that's available topically that's FDA approved. And they're talking about utilizing it with other different treatments. So they're asking through the social media system, what about utilizing it with retinoids, or how do I use it in relationship to my skincare system? Retinoids are the most common, but it could have been other acne medicines like benzoyl peroxide and others. So to me, that's something that really should be answered by a health professional. By the office where that patient got the medication, etc. Getting that information online is really somewhat random, and I'd be concerned about, the scientific accuracy of that. That's my own personal opinion. Adverse effects in just about 17% of the patients. General experience about 14% of the patients. 12% with usage instructions. So patients are going other places. Does this mean they're not satisfied with the information they're getting from the dermatology practice that they're seeing, or the clinician offices that they're seeing? I certainly hope that's not the case, but I think it's important to look at this to see the kind of questions that patients are asking outside of the realm of dermatology, because And this is just Reddit. This is not the only place these individuals can go, right? It's tough to read those forward slash places that they go, but I hopefully you were able to pick it up accurately from what I said. But you can certainly look at the article. It's available open access. Now, here's another paper that I think is somewhat interesting. It's by Werpakowski, Susla, and Lal. And Karen Lal is the lead author. Karan Lal from Arizona. He actually does some teaching on in New York, and this is from Lenox Hill Hospital, Northwell Health in New York, and from the New York Institute Technology College of Osteopathic Medicine in Old Westbury, where my father used to work when we lived on Long Island. He worked in Old Westbury. So this actually touches my heart a little bit. But it's complications of topical timolol in the management of infantile hemangiomas, a systematic review. It's a it's a long article, but I think it's very important. If you are treating infantile hemangiomas, right, with topical timolol, and there are certain indications where we utilize this particular topical therapy. I think this is an article worth reading because it does show very good support that this is overall a safe therapy to use. There were 22 articles that met the inclusion criteria, comprising 1,780 patients. Local adverse events happened in just shy of 5% of the patients. Irritation, scaling, ulceration, and pruritus, right? Those are things that happened in occasional cases. Systemic adverse events, which is what we would be concerned about in these infants because of it being a beta blocker, uh, were bradycardia, bronchospasm, wheezing, hypothermia, and sleep disturbances, 1.2%. So they were very low. They tend to happen more in patients that had ulcerated or deep infantile hemangiomas and in preterm infants. So we are aware that these things can happen, but typically there's not much systemic absorption of the timolol if it's properly topically applied. I think this is a valuable article to look at this particular therapy in that subset of patients because obviously the parents are going to be very, very concerned and very, very cautious. So having full awareness of what's going on in this situation, I think is very important. A very worthwhile article if you're in a situation where you're treating infantile hemangiomas topically. So I just want to quickly mention before we wrap up some of the other articles that are in this issue that might be of interest to some of you or all of you out there, but certainly some that are involved in some of these different areas, like long-term effects of tear-trough hyaluronic acid filler, a retrospective study by Puana and Montez. And anyone that does hyaluronic acid filler injection to the tear trough area, right, under the eyes, the sunken hollows, knows that that can be uh, trickier than some of the other areas that are injected. And sometimes there's some trepidation with that. These authors go through quite a bit of experience in the cases that they treat with good success, lasting results over 18 months with very, very good results. So it may be an article you want to look at. Another one is Reaching for Stars in Atopic Dermatitis: Efficacy, Safety, Tolerability, Accessibility, and Remission Remittive Effects, STAR, ESTAR. And why am I not surprised that Peter Leo is involved? Dr. Peter Leo is the senior author, along with Miranda Ahn. And this is looking at efficacy, safety, tolerability, accessibility, and remission remittive effects, and goes through all these areas in relationship to atopic dermatitis. Typically, because there are so many more treatments, and it's harder to think about how you're going to select one from the other. So, what they show is that you can have a radar chart, and they make radar charts that basically plot out efficacy, safety, tolerability, accessibility, and remission with different agents that the color codes basically give you a look at the relative differences based on their assessments of the different agents. So you can look at that and weigh it along with the patient. Give your interpretation of it and weigh it. So it gives you a visible guide to be able to do that, and it might be something that you find helpful. There's also ethical dilemmas in clinical dermatology. I found this article to be very interesting. It doesn't offer a lot of solutions, but it gives us a qualitative analysis of the American Academy of Dermatology member survey results on different ethical concerns that they have. And they actually have a listing of specific statements that are made in areas that can relate to financial influence, interaction with patients, work environment, and professionalism, and physician obligations toward patients. And some of these are extremely interesting. And what I found interesting about it is reading what was specifically written, the definition and the quotes that were given by the individuals on why it was an ethical consideration. Some of these I would say, well, that's easy. That's just not ethical. You just flat out say it's not ethical. But some of them raise some questions of exactly how you would handle it. And I think it would be worthwhile to look at to see what you think and what how you might judge handling certain situations, but they do not offer solutions. Also, there's a development of a novel facial age assessment model in a multi-ethnic population for evaluation of topical anti-aging products. This is a multi-authored article. It is actually sponsored by Estee Lauder Company. But what it does is it utilizes a digital uh, photograph technology to look at four different ethnicities across all Fitzpatrick skin types. And that's, I think, a good part of it is that it factors in different skin types, different skin colors on 15 facial age markers, utilizing a photometric scale, evaluating signs of skin aging, and talks about how it might help evaluate what when you're looking at particular products and what they could bring to the table, how you might be able to evaluate skin aging. So it's about the technology, but it does look at results with a particular formulation. I also want to mention a letter to the editor. Okay. This is the experiences of Black dermatology faculty in the United States by five authors: Cara Turner, Abdulaziz Hamad, Victoria Barbosa, Susan Taylor, who is well known to us, the past president of the American Academy of Dermatology, and Nada Elbaluk, who is from USC out in California, also very involved with dermatology and a lot with skin of color. It actually goes over the experiences and the data on the Black dermatologists in the United States, specifically mentioning that there are 3.6% of American dermatologists identified as Black or African American in the database area that they used. They didn't necessarily have they admittedly did not necessarily get a full assessment from across the country, but those are the numbers they came up with. And 3% of the faculty at academic dermatology programs, recognizing that just shy of 14% of the American population is African American. It goes through many questions on many different areas related to how these dermatologists feel about practice, how they feel about burnout, how they feel about their obligations in their practices, their responsibilities, and it gives a variety of different responses. I was happy to see a lot of them were very favorable, but there was some issues that were brought up. So I think it's very interesting in that regard. What I would have liked to have seen is what other groups said, because we don't really know how this measures up in comparison to any other particular group. It could be an ethnic group, it could be a skin of color group, whatever the case may be, just to see comparisons from the different groups. But what I'm proud about with the Journal of Clinical and Aesthetic Dermatology is yes, we have a lot of very high quality clinical articles, but we're covering a lot of other areas that are relevant to dermatology that we may not think about when we're just in that little box of what we're doing in our clinical practices. So I hope you found this episode or interesting. I hope you found this issue interesting. And I'm going to promise you it's just going to get better and better and better. One more review will end 2025. So I'll see you next month.